4 is the foundation for oral rehabilitation, and it's all about what's in a name. So what we are focusing on is oral rehabilitation, not exclusively by means of implants. There are other means, and so it's a really patient-centered global organization. And I think that's rather unique, this global organization, because there are many associations, academies dealing with implants or rehabilitation, but you know, it's only a small percentage of the doctors throughout the world that ever attend such meetings, while we, through the website, which is globally accessible, can reach people even in remote countries that will never attend one of those international congresses. 4 Science is focusing on the scientific basis of what 4 is spreading around as message. And what we try to do is to identify some priorities. And some recent priorities have been how to maintain the health of peri-implant tissues. Or another was, what is the optimal number of implants to deal with edentulism? You know, there is a tendency in some parts of the world to install as many implants as possible, while we know, and that is what one of our consensus conferences could establish, this is really not needed. So this is one of the priorities of the science pillar within 4. And we reflect that on the website. The discussions that take place within the consensus conferences appear on the website, so the proceedings are accessible to the fellows of 4. Besides that, we have established guidelines, which is an enormous task, is that we started with complete edentulism, and on the website fellows can access those guidelines and they can navigate through all parts, going from patient assessment to treatment options to maintenance. So this is what the science pillar of 4 is doing. The treatment guidelines, we started with complete edentulism. The next one, which is taking place now, will be on how to deal with the missing single tooth. What is the best options? To install an implant, to go for a classical bridge, to go for a removable prosthesis, so that will be the second one. And then we'll go for partial edentulism, and so on and so on. And all those guidelines will have the same format. So once you're used to navigate through one of them, it will be much easier to go for the next one. Well, I think the medical education has evolved a lot in recent years. Everyone is aware of it. But what is specific for 4 is that we jumped on that running train by insisting on the validity of training and education through the network. Of course, we still need face-to-face meetings, but besides that, you can have people go to the website to evaluate their knowledge through self-assessment questionnaires, and that is what we provide. For example, we have now one first e-book on the website, which was written by the people from the Educational Council, and it's on the missing single tooth. Well, in each chapter you have self-assessment questionnaires, and that, I think, is one of the great benefits of joining 4. Well, that first e-book on the single implant and its restoration, which was written by Dr. Goodacre and Dr. Naylor, is just a fantastic achievement. We have had a regular contact in between the Science Council and the Educational Council, and the product that we see now is really very handsome and very easy to read. You can even download it on an iPhone, and so that means that you can check something on this subject wherever you are located in the world. And one of the advantages of such an e-book is that many keywords are highlighted within the text. So if there is a question concerning one of those words, you just click on them and you will get access to some full chapters on, for example, a concept of a parafunction. You see parafunction, you click on it, and you get a paper on parafunctions. You also have the self-assessment questionnaires, which I mentioned already. Within that textbook also there are references, and so whenever you pass with your mouse on top of the reference number, the full reference pops up, and this is rather unique. So the text is not interrupted, the text is just going on straight forward, but we want, as a for, always to give the scientific basis for what we are producing. I think the for community can first of all establish, and there is a freedom of initiative given to all those associate fellows. They can establish local networks if they want to. We have forums within the website, and some is concerning a certain region, like you would say Southeast Asia. We have one on zygoma implants. We have different possibilities, and it's only started, and I see that new initiatives will be taken. So this local networking, or this networking globally on a typical topic, is, I think, one of the big advantages of the for community. Well, first of all, we confirmed the election of our president, Professor Friedrich Neukamp, and he has asked us, and we all unanimously, of course, answered positively, to say, let's make a 5 years strategic plan of where for is heading. And so what we will do is strengthen what has proven to work very well, like e-books, like those guidelines, like checklists, consensus conferences, and the networking either regional or on a specific topic. So yes, this first board meeting of the year has been, I think, a very positive moment for every one of us. And we all go back home with, I would say, more enthusiasm than ever.